Hey everyone, how are you doing? So today let's look at the different options that you have to replace a full set of teeth using dental implants, but we are not going to look at the most popular, which seems to be all-on-4. So I've got a load of videos about all-on-4 treatment and how you can have fixed teeth, have it all in a day and all that really cool stuff. But this video is really focused to the other treatments, which I honestly think are a little bit overlooked. These are treatments that seem to be less popular these days for whatever reasons. I know a lot of the patients who come and see me kind of don't gravitate towards these options, and I think it's because of the wording and a little bit of misunderstanding with these options. Okay, so just quickly, the options we're going to talk about today is just a removable denture, which I know nobody wants, so we won't spend loads of time talking about that. But then we have locator dentures, which are commonly referred to as clip-in teeth, and then we have a variation on that, and that's using mini implants to hold in clip-in teeth. So what's the difference between these two options? Because cost-wise there's a decent difference, and any of these kind of what I'm going to call semi-removable options, they do have certain advantages over a traditional all-on-4. So before we get into this in too much detail, we need to ask ourselves some really key questions, and we need to be honest with ourselves. Okay, and the question is really, after, let's say you're still in the research phase, you're in the situation where you think your teeth are terrible, and what is your end goal? Okay, the end goal isn't to have X, Y, and Z treatment that you've researched over the internet. We want to be able to smile in photos, have photos with family, enjoy food with family, and not let the state and health of our mouth embarrass us or restrict our life in any way, really. We want to get to a point where we can just forget about our teeth and start focusing on living our life again. And does it mean that something like all-on-4 is our only solution there? Okay, I'm telling you, it's absolutely not. There are other solutions which will do all of this for you. And this video is really inspired by a patient of mine who we did mini implants for. So this is the much more cost-effective solution, which we'll talk about. And I saw her for a review sort of 2-3 years after we'd done the treatment, I think, and she was just saying how life-changing it is. She can eat apples, she can eat whatever she wants, she doesn't need to think about anything. Her friends have told her so many times that she's got a lovely looking smile. And all of this was done without spending £30,000+ on having all-on-4 treatment. And there are some other advantages to this solution as well, which we'll go over. Another thing to bear in mind is that it's not a kind of a linear relationship with how much money you spend and the quality of the treatment that you're getting. Okay, so if we got, say, mini implants, regular implants, and locator dentures, and like an all-on-4, the cost is going to incrementally increase on these different solutions, but it doesn't mean that they are in some way better. The real trick to this is asking yourself the important questions. What do you want to achieve out of this treatment, and looking at the advantages and disadvantages of each solution, of which cost is just one factor. So let's talk about removable dentures. Removable dentures is just one of those things we just need to talk about and get it out of our system, because for some people, honestly, this is going to be a good solution. It's by far the most cost-effective solution, and although you can get it done on the NHS, I feel that the reason this solution has such a bad name is because of how it is carried out on the NHS. You see, the structure of the NHS system in the UK is really geared towards kind of cost cutting, right? It's delivering dentistry the cheapest way possible because the government's paying for it, and just like everything else in the world, there's been shrinkflation over the years. So you used to be able to get really good quality dental care and stuff done under the NHS system. These days, I don't actually know any dentist who is still working within the NHS system, and there's headlines all over the news every day almost is saying that there's a massive shortage of NHS dentists. Now that I've got that out of my system, a removable denture, if it's made well, can actually have a lot of suction. Okay, so suction is that force obviously just resisting it coming out. And it does take a level of skill to be able to make a denture that fits like this, okay? So let's jump over to the computer. I'm gonna just show you some photos of gums. We can look at a couple of cases and walk through this pretty quickly. Okay, so here what we've got is a mirror. This is somebody's top jaw, and how well a denture fits depends on how well the fit surface of this denture is sitting against all of these micro details inside the gum, okay? And it takes different stages of different molds to be able to get something like this. Now, the disadvantage of a denture, the reason a lot of people don't like it is because it moves around, but I'm telling you, if it's made properly, it's not going to be as loose as maybe something that you've experienced. The lower denture is always more of a problem than the upper denture. The other thing that some people don't like is the thickness of it. We can use different materials. We can make it out of metal, which helps. And the other thing that some people don't like is the amount of coverage, okay? So it covers the whole roof of the mouth. Now, this is something we can't really get away from without looking at dental implants. The whole coverage and the roof of the mouth is there so that it can form that seal so that we get a suction and it doesn't fall out by itself. So what's our next thing? What can we do? Well, we can use mini implants. Okay, so let me find a photo of somebody who's got mini implants. Okay, now forgive me, this was on the day of the actual surgery when we put the implants in, so there is a little bit of blood around here. But you can see this is all that you would end up seeing. This is somebody's lower jaw, this is their tongue here, and these are just mini implants. So what we would do is you start with a situation where the patient's got no teeth, then we put these implants in and the patient would leave typically with a removable denture. Okay, it's not connected to the implants at this stage, although I know a lot of people do connect it. I personally don't like to. I think it introduces a lot of possible complication. Now, we can compare this picture to standard implants. Okay, and you can see that the standard implants are bigger than the mini implants. So these are almost identical situations. Neither of these patients has any lower teeth, and the mini implants are just a smaller version of the normal size implants. Now, what this means in reality is that the standard implants have a bigger surface area, the connection is a little bit stronger, so there is less movement on the implants. Now, one thing which is really different between an all-on-4 and locator dentures, whether it's mini implants or regular implants, is where the teeth get their support. So let's jump back into the photo. And here, the way this denture would be made is it would be sitting on the gum. Okay, so remember the gum is always a little bit movable. Okay, the denture sits on the gum and it sits on the actual implants themselves. Now, what this means in reality is that the denture gets its support from a much larger surface area, or these clip-in teeth get the support from a much larger surface area. So one advantage that we immediately have is that we can start putting teeth much further back. Okay, so if you've watched any of my videos on all-on-4, quite commonly I will mention that the number of teeth you get is limited to how far back we can get this last implant. This last implant is limited by where your normal anatomy, and there's a nerve which runs in your jaw, where that comes out of your jaw. Okay, and how much bone we have above that nerve. Okay, these are kind of anatomical limitations that we have to respect when we are putting dental implants in. And this is what dictates how many teeth you have on your final bridge. So always be aware, if you're searching websites and they promise you this number of teeth, the number of teeth doesn't matter. Okay, you can always make smaller teeth just to get the number higher. What really matters is how much biting area you actually end up with. So with clip-in teeth, whether it be mini implants or regular implants, you actually get more. We also need to think about the cost of the overall treatment. Both of these solutions, mini implants and regular locator implants, regular clip-in teeth, are less expensive than all-on-4 treatment. And I think this is super important because it's not just a little bit less expensive, they are dramatically less expensive. And this is because the treatment is simpler. The prosthetics, the way the teeth are made and what materials the teeth are made out of is effectively a really high quality denture. And this is something that dental technicians have been doing for years and years and years. So it's not a new technology. There's no specialist equipment involved. So therefore the cost of this is dramatically less. The aesthetics of a well-made denture are amazing, right? I honestly think they look more natural than a zirconia all-on-4, and zirconia is typically the material that we use to make all of our all-on-4 bridges. But not only that, if there was a problem in the future, if say a tooth breaks or that everything gets worn down, as it will do over time, then it's easy to repair and work on dentures. Right, so whether they're clip-in dentures, normal dentures, mini implants, all of this stuff, it's all made with high impact acrylic using high quality teeth, and quite often we'll use a metal backbone. Now, let me talk about this metal backbone because this is really important. One thing that a lot of people don't like about removable dentures is the thickness of the thing and how much of the roof of the mouth they cover. Because we now have these mini implants or regular implants in position, and we've got denture clicking over the top and we've got support from everywhere, the gums and the implants, we are less reliant on suction holding these teeth in, okay, because the implants are doing that job. So the actual prosthetics, the teeth, can be made smaller. So typically they're made into like a horseshoe shape, and the metal, using metal on the inside has a couple of advantages. One, it increases a little bit of strength, but secondly, it's much thinner, it's much less intrusive, and it will affect your speech a lot less. And the third, often overlooked advantage of this is that because it is metal, it conducts heat very quickly. So if you have a cup of coffee and it's a little bit warm, you know about it earlier on. You can sense food and temperature much better. And also because the roof of your mouth is uncovered, we have taste buds in the roof of our mouth, and our enjoyment of food comes from the texture of the food as well as the flavors inside it. So you're going to get a much better experience from eating food the less of your roof of your mouth is covered. And that's why we make all of our removable prosthetics on implants in this horseshoe shape. And also because there's less coverage on the roof of our mouth when we've got something like this, those people who suffer with a gag reflex, this again is a suitable solution for those people. So there's two more advantages with the kind of removable prosthetics, and then I'm going to talk about a type of removable prosthetics which I hardly ever do, but I do think is really good. And the two advantages are, number one, cleanability. Now, if you noticed, the photos that I've shown you of the locators and the mini implants, they're black and they're designed to be black. So this is one specific company. There's other companies sometimes will do it with gold, but the reason that this company makes them in black is that it's designed to be an easier contrast. If you've got plaque, which is a white color, on the black, it should be easier for you to see it. And cleaning when you've got removable prosthetics is almost always impeccable, just because it's easier to get to your implant. You just use a regular toothbrush, you clean all the way around them, just brush your gums, clean your dentures on the inside, and you are done. And they are a really good fit. So once they fit, food trapping underneath the denture should be absolutely minimal. But let's say, worst case scenario, something did happen in the future and we lost one of our implants. Well, if you've got a removable set of teeth like this, then it's a relatively quick fix. Okay, I say relatively, nothing's a quick fix when it comes to implants. You have to remove the bad implant, put a new one in. Okay, you're never going to get it in exactly the same place, but because the superstructure, the teeth, are made predominantly of either thin metal or plastic, it's really easy to adjust these materials, so you don't necessarily need to have a whole new set of teeth made. Compare this to All-on-4, where if we lost an implant, that means you have to remove the implant, replace the implant. You'll never get it in exactly the same place. The precision fit of an All-on-4 is really critical, so you'll never be able to get that using the old bridge. So it's a case of remaking the bridge, and the bridge is one of the more expensive components of a traditional All-on-4 kind of treatment solution. Now there is one more set of teeth that we can make, and let me show you this on the computer, because I've never actually done this. Well, I have probably once or something, and I couldn't find a photo, so I did Google search, and it turns out I did write a blog about this a little while ago. So if we are here, okay, so we've got this is the blog article, fake gums on your All-on-4, okay, it's on my website. And if we scroll down, we can see this picture here, okay? So we kind of see what's going on here. This person has had implants, and we've had this metal bar fixed into the implants, but this metal bar is also sitting on the gum. Obviously, this is the model, this isn't the actual patient. But because we have this metal bar now sitting on the gum, and the actual teeth themselves are removable, there's again a number of advantages over something like this. It is still cleanable, okay, not quite as cleanable as if we've got direct access, something like this, but it is very much cleanable, more cleanable than an All-on-4. The metal bar, because you are connecting all of these implants, it splints all of the implants. So in those situations where we've got low bone or low bone density, maybe this could be considered an advantage, but I'm not sure how much I actually believe that. There could be an advantage in splinting implants. Okay, if you've got zygomatic implants, that's a different story for a different video. Okay, but let's assume we've just got standard implants, then connecting them together, yeah, it's great. Now, the advantage here, advantage or disadvantage depending on how you look at it, is that whereas we had the removable dentures and the support was from gum and from implant, in this situation all of the support again is from the implants. So yes, we can put a few extra teeth on there, but it's not loads and loads. Technically, this is still a removable solution. However, with all of these solutions implant retained, they're really difficult to remove. They can be really difficult to remove. That's why I prefer to call them semi-fixed solutions, because although you can take them off, it's not something that if you eat some food that they're just going to start coming off. Yes, there are components which will wear and you might need to get them changed maybe once a year. Some of our patients do it once a year, some of our patients, I don't think I've seen them for 2 or 3 years and everything is still okay. So it really depends on each individual person. So I'm going to leave it at that. I think these solutions are really good solutions. And just because All-on-4 seems to be the more popular thing that everybody's advertising, it doesn't mean that's our only solution. These solutions are tried and tested. People have been doing these for a really long time, and you can get fantastic results, and there's a cost advantage to them. So put it this way, if you're in a situation where you have to have all of your teeth removed and your dentist has told you there's one solution, All-on-4, that's all there is, and it financially is out of your ballpark, these solutions can deliver you a very similar outcome. Okay, remember, it's not the same result, it's a different treatment, but the outcome is the confidence, it's your ability to smile, it's to enjoy, you know, the moments with your family, all this kind of stuff, and it might be within your reach financially. So as always, I'm going to leave it at that. If you found this video useful, please give it a thumbs up, consider subscribing, and I will see you in our next video. Take care.